Views in progress. Okay. All right. Hello. My name is Robert Jones. I am currently enrolled in the nursing program at the University of North Carolina at Pembroke. My service learning project is diabetes management for adults. The reason why I picked this PowerPoint or this topic is because diabetes is a very active thing in my life and in my family. So I understand that if you are recently diagnosed with diabetes, it can be a confusing and overwhelming time, especially with all the knowledge and devices and medications that are out there to help with diabetes. My knowledge of diabetes stems from not only the classroom, but also through personal experience with my family, specifically referring to my father, who was recently diagnosed with type 2 diabetes, and I've been helping with him so far. So the overall goal of this video and this presentation is for you, the viewer, to have a better understanding on how to manage your diabetes. And I'm going to break it down to you with 7 easy steps. Step number 1, and principle number 1, if you want to call it principles, is get your medication prescription filled. Make sure the provider explains to you the type of medication you'll need, and make sure you fully read the pamphlet of the medication that you have. For example, if you're only prescribed metformin, which is a pill form of insulin, that you take it at the correct dose and at the correct time. Also, if you have kidney problems or the removal of a kidney, you're no longer eligible to take metformin because how taxing metformin can be on the kidneys. If your diabetes gets to a point where it's so severe that the pill won't help, that there are injectable versions of insulin that you'll have to take. And the doctor should be able to show you how to properly store, fill, and use your insulin, and you should be able to show the doctor that you can give yourself your own insulin. Another important thing to remember with insulin shots is that you want to rotate the sites that you have. You never inject your insulin at the same spot twice. So, looking about that, principle number 2 is make sure you take the medication as prescribed, whether it be the injection insulin or the metformin, or the pill version. Too much insulin can lead to low levels of blood sugar. Some of those signs are fatigue, pale skin, shakiness, anxiety, sweating, hunger, irritability, tingling or numbness of the lips, tongue, or cheek. And if you start to feel these symptoms, you can counteract them with drinking a sugary beverage or eating a small, simple carb like crackers or chips until the signs and symptoms start to dissipate, and if they don't, immediately call 911. Principle number 3 is that you want to buy and properly store your diabetes supplies. So the blood glucose monitor, little strips that you have to stick yourself with, you want to make sure those are in a nice, dry, cool area, not too cold so the device doesn't damage itself. And you also want to make sure that you properly clean them, make sure that you get rid of the needles and strips properly, so you don't want anyone else in your family to get hurt. Say if they just accidentally pick it up, or a kid picks it up, they stick themselves. Also, be very careful with these things because these things can get expensive. Which next step is principle number 4, which is develop and follow a healthy eating and physical activity plan. With this one, me and my dad had a lot of fun with it. He used to be a chef for the military, so he knows all about cooking. But it's the portions that we have to get right with him. A key thing to remember with these two things is 1, corn and potatoes do not count for your vegetables because they have carbohydrates in them, so that counts as a starch. So you want your half a plate of vegetables to be like green beans, broccoli, spinach, anything green and leafy. Tomatoes count too, just not corn and potatoes. The other thing to remember is if you're trying new vegetables, is ask your provider if there's any foods that you can't have with your medications, because certain foods can hinder or make them work your medications work a little too well, and then you're not getting that therapeutic response that you need at the dose of your medications. Also, with physical activity, actively play with your kids counts as exercise. So you don't have to go to the gym and work out all the time. You can just strenuous hanging out with your kids also works. And test number 5, which is test your blood sugar and record the results. You want to do this because, one, it shows you how well your meal plan and exercise is helping your blood sugar, your overall blood sugar. You also want to keep this journal with you because if you take it to your provider and they see that you're exercising, you're eating right, and your numbers are getting lower and lower, they will lower your medication dosage. Usually, sometimes, will lower your medication dosage to the point where you may, in fact, be able to control your diabetes strictly with dieting and exercise, and you won't need to take metformin. Now, that's not the case for type 1 diabetes, is because type 1 diabetes, your pancreas doesn't produce insulin at all. But with type 2, there's a chance that you can not have to take medication anymore. Which leads me to step number 6 and principle number 6 is recognize the signs and symptoms of high blood sugar. High blood sugar, also known as hyperglycemia, is when you eat too much food and you don't take enough insulin, or it can be caused by illness and stress. There are 7 key symptoms: extreme thirst, the need to urinate, dry skin, hunger, blurry vision, drowsiness, and slow healing. And the only way to really combat this, like with hypoglycemia and low blood sugar, we said to eat a little carbs. But for this one, you want to call your provider, especially if you have no idea why your blood sugar is spiking so much, and even though you're taking the medication. Which leads me to number 7, which could be a reason why your blood sugar could be spiking and you have no idea why, is certain medications, for example this fish oil pill, hinder insulin dosage. Meaning that if you take the fish oil pill with the insulin, the fish oil will coat the insulin and it will just pass through your system without ever having a chance to do its job. Which can be very, very bad, because if you don't think that, about it, it can lead to hyperglycemia, and then it can lead to very dangerous events with hyperglycemia, which is also known as DKA, or diabetic ketoacidosis. And that's where it just, trust me, it's not a good time. But step number 7, if you just avoid, certain things, or talk to your provider if you want to take said supplements, so like fish oil supplements because it helps with the heart, that's a great thing to do. The other thing here is avoid taking Advil, Aleve, and Tylenol, and ibuprofen, all forms of it, because insulin mixed with those types of drugs can cause lactic acidosis, which is your blood getting too acidic, which could be potentially fatal if left unchecked. So that's why if you need to take a painkiller like Advil or something for a headache, or season allergies, talk to your provider first, so they might change you off of metformin, because they don't want this to happen to you. So communication is very key with your provider, is what is a big takeaway point for this video. Speaking of that, that's it. The key quick summary and closing remarks: get your medications filled, take the medication as taught, buy diabetes supplies and store them properly, regularly test your blood and write a record of it, develop and follow a healthy eating and physical activity plan, recognize the signs and symptoms of high and low blood sugar, and talk to your provider if you need to take a new supplement. But again, that's all I have. Thank you for watching if you made it this far. I hope this really helped you out, and I hope your journey with diabetes is a smooth sailing one. And thank you for watching.